Yeah. Okay, so hi, my name is Silvio, and I'll be the host for today's very first show for the WAN Medical Forum. So yeah, after this recording, we'll be putting it up on YouTube. It'll be me, Sister Maria, my little brother Paulo. We'll be interviewing our dad. If you don't know who he is, Albrajo and Coco. Nice to meet you. So just give us a little blurb about yourself, who you are, what you do for a living, and stuff like that. It's your turn.
Yeah, thank you. Hi, Silvio, and Maria, Paulo, and others present in this meeting. Yeah, essentially, the WAN Medical Forum came up as a result of an incident. I was in another forum, was kind of a mixture of so many things, and I got the sound, or call it a recorded audio message in which you could hear someone actually screaming. To my understanding, this person was bitten by a snake, so he needed assistance. And when I got this voice in this other forum, which I was a member, I got kind of motivated and decided to track this voice from the number that was being used to transfer into the forum in which I was a member. So I was able to get a nurse down there in Cameroon, that's in Africa, and try to see how she can now trace this person. It was somewhere in the forest, in the southwest region of the Cameroon, and she had to make her way there thanks to some assistance that I did also. She got there and do what we call tunage. That was the best option that she could do in the middle of the forest, and was able now to transport this patient into the hospital, and this person got healed. Thank God the venom never went up to the level of the heart that it could interact with the organs. So this patient survived. So when this patient survived now, I decided to dissociate myself from that other forum and then create the WAN Medical Forum. Actually, WAN Medical Forum stands for my full names. So that's the WAN stands for my full name. Or others might want to call it Wellness Alliance Network, whichever way they want to call it. But the key thing it is to save the population down there in Africa that they don't have access to health care as we do have it here. And I just wanted to tell you guys also that down there, if you are bitten by a snake or whatever medical condition that you could develop, you get well where you are. That's the bad news. It's not as here in Canada where you just make one phone call and the ambulance come at your doorstep and pick you up. In Africa, we don't have such things. We call it kind of pay out of pocket. Meaning that if you don't have the money, you die on the spot. If you have the money, you survive. So that's the system that they have pay out of pocket, as we call it in the global healthcare system. So with my forum, we've been able to treat so many people in a similar situation. We don't do surgery, just what I call it minor ailments. That is, you could drop a message saying that your leg is paining you or you have toothache or something else. We assess you based on the information that you provide to us. But when it comes to surgery or intense medical assessment, we do have colleague doctors in the forum also. The local doctors are there. For instance, you have the Cameroonian trained medical staff that are also member in this. It's kind of volunteering, not if they're being put on a salary. No one is being paid. But if you choose to affiliate yourself to a particular person or a particular hospital or medical center, that one becomes now your issue. WAN Medical Forum doesn't intervene in that situation. You pay, you do what the healthcare professional tells you, because WAN Medical Forum never sent you to that person. So when you choose to affiliate yourself to one doctor or one clinic, then that now becomes something personal, and you take charge of that responsibility by pulling out the financial cost of such services. So in summary form, that's what we do. Then there's another aspect which is quite interesting. I call it an innovation. There are so many medical schools now popping up like forums, like mushrooms. So the system put in place is not standardized. Say, for instance, you are studying in Sudbury.
Yeah, that's correct.
Yes, and somebody is studying in University of Toronto. The clinical system is the same, but in a Cameroon, it is not standardized. So you are doing something that is not done in the other institution. Just like even the training also is not standardized. So my forum is being used as a reference point in the sense that the things that the lecturer never explained in classroom, you have that freedom to equally come to the forum and ask. For instance, I have a case, or we've seen lots of cases that keep coming up when it comes to therapeutics, pathology, and also other things that they keep coming up. Just to tell you that that student maybe never understood explanation in class, or is kind of assignment given to him or her to do. So we do handle such things. Sorry, we have a similar situation where a student was asking me in biotics, or what we call in microbial stewardship. In microbial stewardship is quite challenging because you have various classes of biotics, like the beta-lactam and the carbapenem and the other things that you see them time and again. So she could not understand neither the head or tail of what they were saying. So she was kind of pleading if I can handle it in the forum or on a one-on-one basis. So we do have also academic component attached to the medical forum itself. So we have three things at the same time. We do lecture also. We do also handle medical situation, real-time services, and also other stuff coming up as this goes by. Yeah. So then we do also have new graduates. There's what we call practicum. There are lots of cases right now on WAN Medical Forum that students don't know where to go for practicum. They just graduated in the medical school, they don't know where to go for practices. So they come to that forum also and kind of pleading if we know who to link up with them for them to do what we call co-op. The co-op option is not yet there. You might be lucky to find one. Those in the universities are able to associate themselves with government hospital. Those in the private institution find it a little bit challenging. So in the nutshell, that's what we do. Thank you.
It's a very good explanation. And from what I've understood, you have different professionals in this forum, right? You might have doctors, nurses, or whatnot, right? How do you how do you know about the forum, and how do they find out about you? And what you do?
Okay, great. So after the incident of this guy being bitten by a snake came up, and we were able to resolve the equation, my next challenge now was to see how to bring in professionals in the various fields. For instance, at the other instant, it was just me and that patient. Exactly. So we're just two of us now. So gradually, I started now, when I created this forum now, I had to throw that link into various forums. And that attracted a lot of people. At the beginning, we were just about 100 and something. And today, we are 1,025. So you can imagine from 100 and something to 1,025 means a lot. Now, 1,025 formats doesn't mean that they're all medical doctors. No. We do have novice doctors, that is, those who just graduated from the medical school. Because in Cameroon, you have the medical school in Yaoundé, in Boye, Douala, Chang, and I think, yeah, that's the companies you have, which are being owned by the institution, the government institution. There are also private institutions also. So you have an influx of the graduates coming from these various institutions to be part of the medical forum. Having said that, they do not have the skill that we have. I'm lucky to be in the Western world where I studied in Italy, in Europe, and then in the US where I work with senior health, then in Canada. So I have a broad spectrum of what it is, the Western medicine or practicality. They do not have such things. But having said that, they do have some skills also that we in this part of the world we don't have. For instance, they are so advanced in surgery. The Cameroonian doctors, they operate a lot, which is a good news in the sense that they see such thing many. Whereas in the Western world, you don't just get into operation immediately, but that's the part that they are excelling. So you have lots of them in there, meaning that in the case of any surgery, you find somebody in the forum who tells you, hey, come to my clinic and we'll see how to handle it. For instance, you have one good doctor there, Dr. Augustine, a wonderful guy. He treats you for free in his hospital, which is something rare. But when there are cases like that, he tells you, come to my hospital and I will treat you for free. You have another one, Dr. Apanga, who also does similar thing, also working for Fakohat. He also does similar thing also. He tells you, please come and see me in Fakohat and I will treat you for free. So those are some of those good guys that we find them on the spot. Then having said that, in Italy, we do have Ote Oscar, who is one of the best andrologists and urologists. So in case of such situation that involve the urinary tract or for the male, he handles such cases. We do have also other doctors in Italy, so I just transfer the cases from my forum to them as expertise. They tell me what to do and bring my information back there. So it's kind of 2 and 4 to see how to help this patient for free. We do have also other doctors like pharmacists as well in Parma, Italy, that they are also part of this charity work. We do have doctors also in the UK, one of the best ENT, Eugenie, who does marvelous job. She's very active in this forum. She treats people for free. In case of any situation that involves ENT, she takes care of it without hesitating. We do have also other colleagues from Spain, UK, Belgium, France, and all over the place. We do have also Tolifa Akem, a very good guy, well trained, he knows his diabetic at fingertips. Metabolic disorder, he's well trained also. So he also do contribute, chip in with some challenging situations. The rest of the staff are all based down there in the Cameroons. So that's it, if I've understood your question. Thank you.
Yeah, thank you. And then another question also had was, what's your vision for the forum? You know, like where you are now, where do you want to take it in the next couple of years or so, next months, all in all, right? What do you see in the future for this forum?
Yeah, okay, that's a great question, which what I would say is, if I have the money, I will offer scholarship to students, because from what I have discovered for these years, you can imagine from 2017 to 2023 is a long way. So I have a lot of loopholes involved in the healthcare system in Africa in general. By the way, we have another doctor from Rwanda who contributes a lot also. So you see, it covers the whole of Africa. We have also doctors from Sierra Leone. So it's not just Cameroonian doctors. We have doctors from Sierra Leone. Nigeria has a good quality of nurses, great nurses, of course, bringing in more information. So the conclusion is, I don't want to blame the students. It is not their fault. So to come back to your question, I will focus on training students, what we call hands-on Like what I did in University of Boya, I did offer master's program in pharmacology and pharmacotherapies. So there, the lecture were quite interesting because I make them see for themselves throughout interactions. So when you're handling such cases, you need to know which drug to use and in what medical condition, like the typical cytochrome P450. If you don't know cytochrome P450, then you're just wasting your time in the medical school, to cut long story short. So I will make cytochrome P450 compulsory. Whether you're doing nursing, midwife, or whatever thing, you must understand that aspect in pharmacology. To be more precise, we say pharmacotherapeutics, because otherwise it's more specific now. That's what I will do. Because the moment they had a good grip of therapeutics, you reduce kidney failure in the Cameroon. Kidney failure is a big issue, not only in the Cameroons, but also Africa in general. It's a huge disaster. So it's something that we can hold it, and to hold it, we need to implement therapeutic background. You must know it, and the only way for you to know it is by understanding cytochrome P450. Thank you.
And so, without taking away, some of the achievements that also some of the positive things that we have here in Canada, right? What are some benefits that we also have over in Cameroon, in Africa as a whole, that you found? Any good things?
Yeah. Okay. Good things. What I will say is the practicality. They start the practical at an early stage, as compared to Italy, where I went to university. And I can tell you that in Italy, you don't see the patient immediately. That you don't have hands-on patient in year 1 and 2. But you only have access only at the end of your course. That's when you start practicing. But whereas in the Cameroon, it looks like they start even from year 1, going towards seeing the patient, which is a good thing because they groom you in the system. So by the time you get to the end of your training, you already have hands-on. So that's something which I find very interesting. But having said that, it's risky also because at that younger stage, they might end up even killing some of those patients. So you see that there's some good and there's also some bad things. The fact that patients don't have rights is a very bad thing because the healthcare professional can do whatever thing he or she wants, and those are his rights, which I see it unfair. There should be that option where you can also dialogue with the doctors. Unfortunately, the African population, they don't have that access, and what we call empowering a patient. That's why my forum is doing a great job in the sense that we open their eyes. Before they see the doctor, they already have an idea what to say, what to ask, and what not to ask. Whereas before that incident, there were no such platform where you can have an idea of what is an illness. For instance, talking about the kidney. In that forum, nobody knew it before. But now that we have all such things, they are beginning to understand which is the human body and what it is. So that's some good news. They are fast learners on that platform, honestly.
So, how was the forum?
How
old is the forum? Why did you make it?
That forum was activated in 2018.
And what's like your favorite part about the forum? Like, what's like the best like the part that makes you like really like excited about it?
What made me excited?
Yeah, about the forum.
Okay. There are some interesting cases that they come up time and again. For instance, you see some wrong prescriptions. I call it totally wrong prescription coming up time and again. That motivates me because those of them down there, majority don't know pharmacotherapy or call it therapeutics. So they don't see the danger. Whereas I see it because I know what it is. Again, as I was just saying here, knowing cytochrome P450 or therapeutics, you're able to spot out the errors. So I easily spot them out and I try to correct them. So when I see such cases, I stop the patient. I say, don't buy this medication. Or if you bought it, you take it back to the pharmacy where you bought it and get the right one. So that's the part which is exciting.
It's good. And then, so back to your upbringing in Cameroon, actually, like, so in Cameroon and then like in Canada, like, what's like the part you messed up the most about Cameroon that you don't, like something in Cameroon that you have that you wouldn't really have here in Canada, like something good, something positive.
Say it again.
Like a positive thing about Cameroon that you remember, that you miss, that you might not have.
Yeah. I would say the social aspect and also the respect that you have down there. Again, it is, I see it really being a healthcare professional in Africa, you are held at the highest esteem because there's an adequate shortage of healthcare professionals down there. So that's why the few ones that are up there are looked upon as semi-gods. Like the saying goes, in the country of the blind, someone with one eye is the king. Whereas in Canada, we have tons of them. In fact, you have medical doctor driving taxis. So they don't see it here as something great. But down in Africa, it's very rare. So they respect you a lot. And which, on the other way around, it is risky in the sense that those doctors also use that power to, I would say, kind of overwhelm the patient.
They abuse it.
Abusing, Like what I was just telling you, that there are no patient advocates. It makes it too bad. Yeah, and then another thing also is their style of prescribing medication. The patient down there are over-medicated, which is not supposed to be that way. Because you see, a long list of medication is like grocery shop list. But that's scary. In Canada, you will see such things. We don't have grocery shop list in Canada for patients. No. You go for the drug you have been told and it ends there. But in Cameroon, you have a good chunk of it. So I see it overwhelming to the patient because they don't have the money. So I expect the doctors or nurses or whosoever to prescribe just the basic drugs that are required and stop overwhelming them with so much medication that are of no use, because some may even end up killing them. Yeah, so essentially that's the good aspect, and then the bad one also when it comes to prescribing. Thank you.
So yeah, thank you. So a little bit off topic, as you know, today's Father's Day, right? So in your eyes, what would be the most beautiful aspect of being a father? What's the best part about it?
I didn't catch the question.
What's the best part about being a father?
Okay. I think it's playing with kids. I think that's the best part to me. Once in a while, do what we call the role play, to also give the child to behave like that and you behave like the child. I think role play will be wonderful to understand also, because if you keep being that all through, the kids will never understand. The kids might see it kind of being oppressive. I think so. So once in a while, I expected parents also to behave like children. Like, so you give them that power also for them to behave like that once in a while, so that you guide them also how to become a dad one day. Because if you keep being that and they remain children, they end up not understanding what is going on. So when you start switching that role, it is kind of amazing idea. The kids also understand that, so today I want to behave like that. It's kind of a replay of the whole show, which I see as something interesting.
Yeah, I guess it would also give someone little time to relax from the hustle and bustle of like everyday life. You're working
Yeah.
every day, making money to hopefully save it for like plans in the future. Maybe you might just like put that to the side, obviously, right? Spend time for your kids, talk about stuff, whether it be school, goals, and all whatnot, right? It's good, yeah.
Yeah.
I have Maria here. She also has some questions for you.
Yeah. Hey. Hello.
Okay, so I just had 3 questions. So the first question was, how many members are in the forum?
Yes. Okay. At the moment, I will say there are over 1,025, because if you look at the forum right now, it is maxed out, meaning that there are some members hanging outside. And that's another thing I wanted to say, that when the forum gets maxed out, my personal email, or call it my personal WhatsApp account, becomes another forum, because they channel all their worries now to me with the excuse that WAN Medical Forum is full. If you look at it now, it's actually full. So those other patients who want to get in now, they can't get in. So they are forced to come to me. So that's why once in a while I clean the forum. How do I clean it? I ask some basic questions like 1 + 1. You tell the answer, you stay. If you can't answer the question, you leave the forum. Or you provide your day of birth and the month of birth. Just 2 basic things. Just to tell who is dummy and who is active. So when we find so many dummy members, we get rid of them. We kick them out and bring in those who are hanging. So the max again is 1,025.
Okay, thank you.
Yeah.
And is it like exclusive?
Yes.
Okay.
Yeah.
What are
That's
the requirements?
We have members from all walks of life. That is, we have the medical doctors, the nurses, the midwives. We also have university lecturers. We do have patients now from all aspects. So it is not limited only to those who went to medical school. We do include patients also. You could be having an illness, you are free also to be part of the forum. It is free of charge. You are free to ask your questions, you are worried, we are there to help you, and that's it. And last year, we actually offered scholarship. This scholarship was in the form of stethoscope, because the stethoscope, you use it to listen to the lungs. That's a device that used to assess patients. Every doctor must have one. So we came up with the idea of offering 10,000 Cameroon local currency to buy one for each patient, for each brilliant medical student. It was kind of a meritocracy principle. So we have over 500 students in the forum, but we cannot provide stethoscope for 500 medical students. It's impossible. So we select the best 10 and offer just 10. And we will keep doing that going forward. Hopefully some years to come, we might do something bigger than that. Who knows?
Okay, thank you.
You're welcome.
Oh, hi. Thank you for watching this interview with Dr. Wan. Please consider liking and subscribing. It will help the channel grow. Bye!